Hello, everyone, and welcome to this CIO Leadership Live, where I'm joined by Dan West, who's the CDIO at Health and Social Care in Northern Ireland. Dan, great to have you with you this afternoon.
Hey, Doug. How you doing?
Fantastic. Yeah, really good, thanks. And looking forward to this, actually. We're going to discuss health and social care reform in Northern Ireland through a challenging year, digital projects through the pandemic, ongoing political instability, and that age-old question of balancing transformation with the business as usual. Dan, I want to start with just talk me through how health and social care has been challenged over the last 12 to 18 months in your role and what that's meant for your role as well. Because I think it is key to note that although you've been in position longer than a year, obviously, it is your first CIO role. So just talk us through the challenges that you face and what that's meant for you.
Yeah, well, I think it goes without saying that the COVID pandemic has left a long shadow over national health and care systems globally, with the UK and Northern Ireland being no exception to that. There are unprecedented levels of fatigue amongst all of our staff against the backdrop of the sort of growing likelihood of industrial action over pay. So from a people perspective, things are pretty strained at the moment. All of the capacity and operational challenges that were present in healthcare prior to the pandemic are kind of magnified now. So waiting lists have grown, diagnosis and treatments have been delayed or missed during some of the burden that the pandemic brought to the system, and people are really struggling to get timely access to services. The economic slowdown and the rising costs, particularly if you think about it, energy costs in the health and social care domain, where estates generally are fairly big, and that's a fairly big part of our cost every year, means that the budget outlook for the coming years is in a fairly bleak place, particularly for those publicly funded health systems in Western Europe, like the NHS and health and social care in Northern Ireland. So in Northern Ireland in particular, and you alluded to this yourself, the absence of a functioning devolved executive due to the ongoing dispute by the DUP over the Northern Ireland protocol adds to all of those challenges. And really that manifests as a reduced ability to arrive at a budget settlement that shifts resources into the health and social care space, given some of the context that I talked about a minute ago. So really, you can think about how my job has had to react to all of those stimulus over the course of the last 18 to 24 months, as you say. So the challenges that we faced are clear, but there are some positives in there. We ought to celebrate that, and we ought to recognise that there has been some real progress made. So to sustain health and social care services into the future, we're going to need to find a way to get more output from the same, or maybe even reducing resources. And I don't think anybody would suggest, certainly not you or I, that digital is some kind of panacea to all of this. The real requirement really is in and around staff, but the absence of the money to hire more doctors and nurses and the lead time in then training them to bring them into the service means that digital has got to be part of the jigsaw puzzle that we use to try and address some of those challenges. The projects and products that we delivered during COVID adopted some of the techniques and technologies that allowed us to move really quickly to deliver digitally enabled once for Northern Ireland services. And maybe that's one of the things that we could unpack a bit today as to how some of those projects have allowed us to evidence that the trajectory for digital allowing us to address some of those issues is maybe something that we should continue to pursue.
Yeah, no, some great comments there, Dan. I think it came through loud and clear in your application as well, in terms of new ways of working and that kind of digital acceleration. But as you say, an interesting time in a sense that given the economic situation, nonetheless, are we going to swing back maybe to not IT as a cost center, but maybe there's going to be some redistribution there, you could argue. But before we get on some of the challenges, I do want to, you mentioned about some of the projects through COVID, and I think there's an array of really interesting work that you've done in terms of public health intelligence platform, shielding registry, digital self-trace system for staff. Which do you think has had the biggest impact, and why?
Yeah, I think there's probably an impact on the experience of citizens in interacting with health and social care services, leveraging cloud technologies and smartphone apps and agile delivery methodologies that allowed us to move pretty quickly to put in place experiences in a way that we just hadn't really done previously. So things like the COVID Care NI app, which was like a symptom checker and a chatbot that provided people with a personalised package of advice based on their personal circumstances and how that related to the fairly rapidly evolving regulations. The Stop COVID NI app was the Bluetooth proximity app that we did in Northern Ireland. It was the first one to launch in the UK and the first globally to achieve international interoperability, given our shared border with the Republic of Ireland and the epidemiological unit of the island of Ireland. And it was really important for us to create that sharing capability. A new way of delivering vaccines and vaccine management and appointment booking capability for convenience for citizens was another really big one. And then, as you said yourself there, Doug, the contact tracing platform and the self-trace, the kind of self-serve service, all of those things really changed the paradigm. It kind of moved away from the really traditional matriarchal approach to delivering healthcare services and more galvanized and empowered patients and their families in how they interacted with services. And I'm really interested in how we can maintain some of the momentum around those experiences in a post-pandemic world to leverage technologies and techniques like that to deliver improved and modernized experiences and services.
Yeah, no, super interesting actually on that. You mentioned about the kind of changing the paradigm and that pace of change, because I've heard a few leaders in public sector and in healthcare, no less, that are worried about that kind of return of the red tape and the bureaucracy that maybe slow down some of that innovation. But Dan, talk me through one thing that stood out for me in your application. There's a phrase which I think was kind of shades of Winston Churchill actually, but was never waste a crisis. Talk me through that. What do you mean by that, and what's that meant for your role?
Yeah, I think I've said already, we've been able to accelerate some of the things that we knew were needed. So we've talked about these digital services and products that we spent some time building during COVID. But also we had a level of adoption or a rate of adoption of collaboration and flexible working tools that we just simply wouldn't have seen in peacetime, if you like. So a bit of a shaggy dog story. I was doing some work in a trust in the English NHS, and we'd done an early adopter of O365 and implemented Teams and some of the other tools that you get with that. And the reason that the trust was so interested in that was they had a big estates problem. They didn't have enough office space for their staff. So we'd given everybody these tools and rolled out laptops and mobile solutions, and then said to people, right, let's start to redesign the operating model. Let's start to redesign how we work together. And there was such a resistance to that, where people felt they still needed an office cubicle with a bit of a desk so that they could put their pictures of cats next to their PC. And that one day where Boris said everybody who could work from home should, just had this exponential increase in the use of virtual tools and capabilities, both in the way that we interacted with each other as professionals and the way that we interacted with our patients. And what we need to try to make sure, both in how we deliver digital capability to our staff and how we do digital enablement of services for citizens, that we don't allow that kind of elasticity in bureaucracy to snap us back to the traditional ways of working, at least exclusively the traditional ways of working. So the fail fast mentality, the iterative mentality to get product out there that can help us to change the way people work and live, I think is one of the key focuses for all technologists, and certainly somebody in my position over the course of the next 6, 12, 24 months, in parallel to the big public scrutiny that's coming, the big COVID inquiry that's going to make people a little bit more risk averse than we were able to be collectively during the pandemic. So let's not allow some of those big public processes to push us back into the traditional ways of working exclusively.
Yeah. Does that extend in terms of that kind of never waste a crisis point there, Dan, in terms of how you collaborate internally? Does that extend to, so I know you've been some quite interesting work you've done in terms of how IT and kind of clinical is kind of collaborating. I think one example you gave me a while ago was kind of moving from this kind of waterfall method where everything was discussed by clinical teams and then essentially chucked over the fence to IT, to IT be much more involved in that process from the get-go.
Yeah, absolutely. So I think part of our ability to do that was created in my role. So my role is at the department, so we've centralized a lot of the thinking around technology strategy and technology innovation. And so there's a level of influence that just allows us to get into a conversation, perhaps upstream of where the technologists previously would have been engaged in a discussion. But I think what we saw a lot of during COVID was the digital tail wagging the clinical dog.
Mm-hmm.
And historically, we've really tried to avoid that. We've tried to have the operational care model and service design drive out technology requirements, and that's right. I'm not suggesting that shouldn't be how the world works, but I think during COVID, the technologists were able to look beyond the current operating environment where we were trying to build the pandemic response to see around the world what the pockets of innovation and best practice were, like building a new vaccine management platform with a publicly accessible appointment booking service. That wasn't something that came out of an operational or clinical policy conversation. That was actually something that a colleague in Scotland had introduced me to as a notion, and I'd then taken as a digital leader to the public health operational and clinical response to say, we need to start thinking about this. So I think we can change the dynamic. We can bring digital upstream in the policy conversation. And as you say, we can collaborate differently with clinicians who have an increasing understanding through COVID and more generally of the benefit and potential impact that digital can have in the way that they form relationships and transactions with citizens. And collectively, all of those considerations then allow us to just change the dynamic a little bit and to accelerate how we can transform services in an environment that actually is pretty resistant to change.
That's very true. Yeah. Dan, it's interesting. We spoke, I think, over email some months ago about the idea of balance or work-life balance. And I think at the time you kind of sagely noted the concept of balance was kind of almost not applicable, perhaps in your role or your teams in terms of the work they were doing. Talk me through where your teams are now. I know you talked about, this concept of normalizing unrealistic expectations, the high intensity work, almost needing spidey sensors, I think you said to me before, to kind of figure out where the pitfalls are and to avoid them before they happen. And obviously we mentioned the bureaucracy as well, and that's before we even talk about recruitment and the kind of tough recruitment market at the moment. So how would you give us a reading of your teams, where they are at the moment, what the challenges that lie ahead?
Yeah, so I think a lot of us during COVID were sort of hoisted by our own petard. Like we did good work and we did it really quickly, and so that then became the normal expectation that technology would be able to expend energy at a rate that allowed us to solve problems like we had been during COVID. And it is unsustainable. I think most industry sectors, anybody listening to this interview would recognize that COVID was really hard and probably isn't a working arrangement or rate of work that anybody would be comfortable with into the future. So I think there's a little bit of a management of what is a reasonable set of expectations. And for us, we're trying to shift from what felt like quite a tactical mode of operations into something that's on a slightly more strategic footing. So in Northern Ireland, we've recently launched a digital vision and strategy for health and social care that takes us from now up to the end of this decade. And defines a vision for the future, but also starts to build a little bit of a journey map. And through managing the investments and our delivery portfolio in line with that strategy that's being socialized at the moment in Northern Ireland, we can try to get onto a more deliverable and reasonable footing in the asks and the work that we're seeking from the team. But I think one of the issues that I've got, that we've all got in healthcare, is about prioritization. Yeah. There's so much that we need to do and so many policy initiatives that maybe were on a back burner during COVID, that because everything's a priority, almost nothing is a priority because you're trying to juggle too many balls or spin too many plates or whatever phrasing we're going to use. So I think there's a real need as leaders to be clear on what our prioritization criteria are, and then to build a body of work that we can ask our trusts, the delivery organizations in healthcare, to take that journey along with us while also managing their own operational BAU. So prioritization, I think, is becoming a real key to a more deliverable body of work.
Yeah, makes sense. Dan, we're coming towards the end, but I want to finish on two final notes. And the first of which is a little bit of a tangent, but give us a brief kind of top line view of the flood project that you've worked on. So I think that's quite interesting. A lot of our viewers, I think, be interested in the work you've done there.
Yeah, so I've never done startup stage work in technology, and it was something I was quite interested in building my own experiences in. And also I'm quite passionate about helping the local technology sector. Belfast is getting a really good reputation now for technology, so getting involved in a startup business and taking it through a launch was quite an interesting opportunity, and one happened to come along, and as if reforming healthcare wasn't enough, I decided I was going to take on global climate change. So there's a young kind of reg tech, insurtech business based here in Northern Ireland, and I'm helping them to create an initial suite of products that will work in amongst governments, the insurance industry, and home and business owners where they own their properties, to try and address the fact that 1 in 5 properties in the UK can't currently secure risk reflective and affordable insurance against flood damage. And that is just not sustainable for us as a society. So technology has a part to play in the information relationship between governments, the insurance industry, and those businesses and homeowners, such that as we increase resilience of our properties through flood risk interventions, we can build that body of evidence that drives us towards a risk reflective market in insurance. So it's a really interesting opportunity and a great distraction, and just a different environment to work in compared to the kind of health and care day job.
Yeah, but as you say, not an insurmountable challenge there, but as you say, nice to get that breadth of work. So, Dan, that's brilliant. I guess my last question for you is where next? I think you mentioned that the digital strategy that's not long launched. Obviously, politically, the kind of the lack of an executive is quite clearly a hindrance at the moment. What would you say? Where's your direction of travel? What are you kind of working on or will be working on over the next 12 months?
Yeah, the strategy provides the sort of logical conclusion to a portfolio of investment that we're already working on. So we've got a large number of really significant projects and programs that are in flight. Things like the creation of a single electronic care record in Northern Ireland across all settings. So that's acute physical care, mental health, community services, and social care as well, which is pretty unique in the UK. Building a new Once for Northern Ireland medical imaging platform, and a new operating model and associated information systems for laboratory and pathology services, the creation of a new master patient index. There's just this real body of work. And the thing that we need to do, as well as maintaining momentum on delivery and working through prioritization for our trusts to make that body of work and that digital journey achievable, is to recognize that those projects and programs are just a means to an end. The technology itself isn't what we're all about. It's about people, right? It's about people being able to deliver better healthcare services, our staff being able to do their jobs better, about our citizens interacting with safer, more modern and more convenient healthcare experiences. The opportunity to shift health and social care from being kind of an economic burden for society in Northern Ireland to a real opportunity for growth and innovation. And those people aspects of that technology portfolio has got to be our focus over the next few years. In a resource-constrained environment, we have to be able to evidence that all of these technology investments are delivering a real change for people in the region. So that's the plan, that's the focus, that's the next couple of years for me as we carry on this digitization journey in health and care.
Fantastic. Dan, always great to chat to you. Thanks so much for joining me today. I really enjoyed that.
Thank you, Doug.
Fantastic. And of course, thanks to you viewers for tuning in. Hope you enjoyed that session. We'll see you very shortly for the next one. Until then, goodbye.